I was asked to speak on the patient's perspective into chronic kidney disease and end-stage kidney disease and the management. So I wanted to talk about this purely from a patient's perspective. So I've been on dialysis for the last 24 plus years, and I have been on hemodialysis. I have peritoneal dialysis. I've undergone an unsuccessful kidney transplant, and now I'm on home hemodialysis. So given this experience, I thought I'll share a little bit about what patients expect from professionals like whom this talk is targeted towards, that is patient educators. So the first reaction of somebody getting diagnosed with kidney disease is almost always shock. Nobody expects kidney function to be affected. That comes as a huge shock. Until kidneys are affected, many people don't even know what the kidneys do, where they are located, and so on. So there is this huge denial. People think that, no, I cannot get kidney disease. How can I get kidney disease? I've been leading such a normal life. I don't have any bad habits. So there is complete denial and shock when the initial diagnosis is made. Initial diagnosis, somehow people manage, because it has limited kind of impact on their lifestyle in the initial stages at least. But when the patient is told that they need to get onto dialysis or they need to plan a kidney transplant, it comes as a massive shock, and people's entire lives go upside down. Many people have plans of marriage, some people have plans of having kids, some people have plans of going abroad. All those plans go topsy turvy, they go completely for a toss. So all this causes a huge amount of tumult, a huge amount of disturbance in their mind, in their family's mind as well. So it's a huge shock. So as healthcare professionals, all of us need to understand that this is what is expected. Another problem that happens due to denial, due to shock, and so on, is that a lot of patients get referred to specialists or the nephrology healthcare providers very late, and that results in a lot of adverse impact on, for example, the dialysis access. And I believe the previous talk was about dialysis. All of us realize that time is of the essence in dialysis access planning. Emergency dialysis becomes necessary because of the lack of time in planning the access. Preemptive transplant completely becomes impossible because you need dialysis immediately, and transplant definitely takes a few months. Hepatitis B vaccine, which is such an important part of the care of a dialysis patient, that becomes difficult. It takes at least 6 months before the 0126 thing happens. Financial resources, which is a huge problem for dialysis patients, especially in countries like India, that also becomes difficult. When somebody is diagnosed with chronic kidney disease, right, there are a lot of questions that arise in their mind because they have no idea what it means. So first, some of the questions that they have is this reversible? Like, is this like a temporary thing that will come back? Because a lot of misinformation, exists among Indian population in general about kidney disease and so on. So people wonder, is this reversible? Can I get my kidney function back? When they realize that chronic is not typically reversible, the question arises, how long will I live? Especially a lot of young people are getting diagnosed with kidney disease these days. So they think that I am 30, 40 years old now. How long will I live with kidney disease? Another problem in India, like I mentioned, is financial planning, right? Many people don't know how much it costs. Many people cannot afford the treatment. So they have a lot of questions on how much will this treatment cost me? Will my entire life savings get eroded? Can my family and I afford this treatment? Work, which is such an important part of an adult's life, can also be affected. So they have questions on, with this kidney disease, can I continue to work or will I be bedridden? Then some people have heard about dialysis in the context of kidney disease. So they think, will I need dialysis? Because that is like a huge shock for many people. Misinformation about kidney disease always exists in a lot of Indian population. So they think, is this contagious? Can I transmit it to my family? And then neighbors, friends, family, far off relatives, everybody, as soon as they get to know that somebody is diagnosed with kidney disease, immediately they say, ye try karo, homeopathy try karo, ayurvedic try karo, magic therapy try karo, ye baba ke paas jao, aapko theek ho jayega. So alternate therapies is one of it's a huge problem. I think all doctors have encountered this problem. Do alternate therapies work or not? So these are the questions that typically arise in somebody who's diagnosed with CKD in the initial early stages of kidney disease. And then when it comes to dialysis, be it any type of dialysis, there are some standard, questions that, and I'll come to each specific aspect of different types of dialysis as we go along. But any type of dialysis, there are a few questions that arise in everybody's mind. So one is like in CKD, can I work? Because dialysis tends to eat away a lot of the productive time of a dialysis patient, whether it is hemo or PD. So the question is, how can I work? Can I work at all, or will I be, at home throughout? Which again is a huge problem. Some people are exercise freaks, so they think, can I exercise? Can I go to the gym? Can I go for a jog? Can I play tennis? Can I swim? These are the questions that they have. Can I travel? Now, one thing that all of you, as you are going to become healthcare professionals, or you are healthcare professionals already, you all should realize that the first three things are all yes. Anybody on dialysis can work, they can exercise, they can travel. It is about tailoring your dialysis treatment to make all this possible. I have been on dialysis for the last 24 plus years. I work, I exercise, and I travel. And there are many patients who are doing all these three things. Fourth question is, will dialysis affect my sex life? Can I have children? People who are married, they tend to have this question. So while it may affect, it is not always compulsory that it affects. It varies from person to person. And I'm sure when the nephrologists take up these questions, they will definitely answer this in a more detailed manner. Will there be any diet restrictions? Again, there will be diet restrictions, but it need not hamper your life. It need not mess up your mind. There are ways to work around those diet restrictions. So these are some very basic questions. I've given some patient perspective on this, but I hope the nephrologists would take this further and answer your queries. Coming to hemodialysis, all of us know that hemodialysis is the most prevalent modality of dialysis in India and much of the world. So the questions that people ask is, how long will I have to be on dialysis? That is, will I have to be on dialysis forever, or is it a few years thing? What is it? How many times a week do I need to do it? Now, one thing we need to realize is most of the developed world has a thrice a week mandate. Thrice a week is the minimum. But in India, majority of the patients do it twice a week because of financial reasons and various other reasons. So again, that depends on the individual circumstances, the nephrologist's prescription, and so on. Is it painful? The question is, the point is, it may be painful, but there are ways to, again, avoid the pain or to reduce the pain. How much will it cost? And are there any options for funding or subsidy? So cost, again, varies a lot from city to city based on various options, whether you're reusing the dialyzer, it varies a lot. Are there any options for, some kind of a subsidy or some trust or some kind of a charitable option where the cost can be reduced? So these days, many places have a lot of such options where very good trusts have set up these dialysis centers, and where the patients can get dialysis at a reduced price. What happens if I don't do dialysis as per my nephrologist's prescription? So this is something that happens that people cannot afford. The nephrologist says thrice a week, they can afford only twice a week. So what happens? This is a question that they have. So nephrologist has said 3, why do I need to do 3 per week? That is one more question that many people have. And then, is hemodialysis the only option, or are there other options? So unfortunately, many patients in India are not even told about the other options in dialysis. People come to the nephrologist with kidney failure, and the first line that is told to them, okay, plan for a fistula. I mean, what about the other options? The patients want to know that, is hemodialysis the only option for kidney failure? Are there other options? So when I talk to some patients, many times they have no idea that there is any other option. So that is one thing that is very important, education about the various options. Peritoneal dialysis, a very small number of patients in India do PD. I think all of us are aware of that. So the questions that they have again are, how many exchanges, how much does it cost, options for funding, subsidy, how much time does it take? So PD, while it takes only half an hour, if somebody is working, then can they pull out really half an hour in the middle of the day? So those are questions that they might have. Painful, typically in PD, there is almost zero pain for the basic exchange, but there could be pain if there are complications. So that is something that they need to be aware of. Catheter hanging from the stomach could be a major turnoff for a lot of patients, right? So that is one question they have, that how can I go about my day with a catheter hanging from my stomach? So they need to be told that they are given a pouch where that catheter is placed. And then a lot of misinformation, or rather information exists about the high chance of infection, but they need to be told that while there are ways by which you can avoid a high chance of infection with PD. So that education is very important. And then since they're doing PD at home, they're always worried about, is there a chance of complication at home? What happens if that complication happens at home? Who will look after me? Home hemodialysis, it's very new in India. Very few patients are there, but a lot of people are intrigued. Can I do dialysis at home? I mean, it'd be so nice if I don't need to go to the hospital. The questions on cost are paramount, because does it cost the same? Does it cost more? How much more? Again, funding, subsidy options. Then some people don't like to have that machine equipment at their home. So they're worried about how much place it will occupy. The complication issue, they've seen a lot of people dying on dialysis in the centers. They're worried that what will happen if there's a complication? Then there is the obvious question that do they need a technician to do it, or they can do it on their own? And then the RO plant. Everybody knows that an RO plant is needed for home hemo. Where do they need to keep the RO plant? How big is it? What about the tests? And how often? The frequency and the duration issue always comes. Another thing is, a lot of people have heard a lot about these new devices that are coming, and there's a WhatsApp video that is floating around the internet that claims that the implantable artificial kidney is going to be reality in 2022. So a lot of patients have this question that, is it really going to be available in 2022? If it is, then can I get access to it? So that is one, lot of people have that question, especially since that latest WhatsApp forward. Coming to kidney transplant, and I have very little time, so I'm going to quickly go over this. What are the chances of success? A donor, is it possible to pay and get a kidney? What are the risks for my family member? If a family member donates, what risks do they have? Cost, of course. And then how long will the transplant work? And then cadaver transplant is now a reality in India. While it is very less, they want to know how they can register for the cadaver transplant. And then again, the success of cadaver transplant, success of a transplant in general, what are the chances? How long will it last? And so on. And then after the kidney transplant happens, how much time can I go back to a normal life? Like how much time can I go back to work? Can I go back to exercise, travel? Again, the sex life question, can I have children after a kidney transplant? They've had a lot of restrictions on water and diet during dialysis or before the transplant. Once I get a transplant, what are the restrictions? It's going to be a different set of restrictions, but what are they? And then what kind of diet will I be asked to have? In summary, I think we need to realize that we need to be a partner in their journey rather than giving instructions. Unfortunately, in India, healthcare is becoming, or has become, a lot about giving instructions to patients, probably because the less time that nephrologists have. We are a country with very small nephrologist to patient ratio. So we need to be a partner rather than giving instructions. So for example, just rather than saying no fruits on hemodialysis, talk to them, understand what fruits they want to have. And I'm sure there are dietitians who can figure out how they can have fruits. Choices are very important. Like I mentioned, that when somebody's kidney fails, hemodialysis is not the only option. There is hemodialysis, there's peritoneal dialysis, there's a kidney transplant, there's conservative care for patients who are too old and infirm, who don't have very good cognitive processes. They can also opt for conservative care. How many people in our country are offering that option? Catheter also is, Permacath is there for access, AVF, AVG. Explain the options and explain the pros and the cons, and jointly take a decision. Don't decide for us patients, is what I say. Goals of life can be very different from of a 25-year-old compared to a 60-year-old. So each patient is separate, different. Talk to them and come up with the plan together. Even within the same age group and gender, there could be differences among people. So it's important to discuss and then come at a joint decision. So that's all I have. Happy to take any questions.